be at 12:11 now. There's been an increase in heart-related deaths during the coronavirus pandemic, and new studies in the Journal of the American College of Cardiology reinforce previous findings that many of these deaths are the result of delayed diagnosis and treatment. We talked about it with Dr. Warren Levy. He's a board-certified cardiologist and president of Virginia Heart. He talked about people avoiding going to the ER out of fear of contracting COVID.
This is the same message we tried getting out back in the spring during the first surge. We were seeing markedly lower number of patients presenting to the emergency departments with heart attacks, and we knew that the heart attacks didn't just vaporize. People were staying home and writing out their heart attacks at home, and for that reason, we saw an increase in mortality or death from heart disease because people were afraid to come to the hospitals. In addition, during that first surge, we closed down so much diagnostic testing because we wanted to reserve our hospital and all medical facilities for COVID patients, that by decreasing diagnostic studies, we weren't picking up on disease early, and therefore patients were suffering complications or even deaths from undiagnosed disease. And so this time around with the post-holiday surge, I think we're taking a very different tactic. We are continuing to do all of our diagnostic studies to pick up on disease. And once again, we have to encourage patients to please come to the hospital if you have any symptoms that are worrisome. You're not going to get COVID by coming to the emergency department. If you come in with heart symptoms, you're going to be kept very separate from anyone with respiratory symptoms, and it's a safe environment. We've certainly learned how to keep our hospitals and our ambulatory sites completely safe for patients so that we can provide them with the best possible care.
Dr. Levy, those signs and symptoms are so important. What are some of them so that people don't ignore potential problems?
Well, the classic symptoms, Deb, of course, of, acute heart disease or ischemia, meaning part of the heart's not getting enough blood or oxygen, is a heaviness or pressure or squeezing in the chest. It can be in the neck or jaw or go down the arms. It can be associated with increasing shortness of breath or a cold sweat. If you have any of those kinds of symptoms, you need medical attention right away. We also need to remember that women actually have more heart disease than men, although they get it at a slightly older age, and they can have atypical symptoms. So if there's anything that doesn't seem right, please seek medical attention. The other important issue we found is that folks who've had COVID, although more so those who had serious disease, but even some with mild disease, have had cardiovascular issues afterwards. There's a delayed effect. And so if you've had COVID and you're having increased shortness of breath or diminished effort tolerance or stamina, you really need to get checked out because there are signs and symptoms and underlying pathology or weakening of the heart muscle that can occur after COVID that we need to pick up on early and treat.
I assume that you are strongly recommending that for your patients and others who have heart issues that they need to be getting the vaccine for COVID.
You've got to get vaccinated, especially the 65 and up population. Remember, they only represent 12% of cases, but over 85% of deaths. So as soon as the vaccine is available to you, please get it. We're going to make a huge impact on this disease and finally get beyond it and get back to our normal lives. But you need to get vaccinated.
Good advice from Dr. Warren Levy there, board-certified cardiologist, president of Virginia Heart.
Up ahead on WTOP.